I was really privileged to be able to present this work at ASH this year. Excuse me. This was a an effort that was started many years ago, actually, by Andy Kolb and others, bringing together the Children's Oncology Group and investigators in Europe and the Leukemia Lymphoma Society to really try to address some unmet needs in the world of relapse leukemia, particularly for pediatric patients. Some of these unmet needs are, for example, there really is no standard of care right now for treating most patients with relapsed leukemias. When a patient is newly diagnosed, we have existing protocols. Everybody knows exactly how that patient is going to be treated. But when a patient relapses, it's really kind of dealer's choice. There isn't one accepted standard of care. And one of the reasons for that is that we just really don't have a lot of data collected for children after they relapse. There aren't as many organized clinical trials that are systematically collecting that data. And so that's one of the main things that we're really trying to do with this screening protocol. So there are two objectives with the protocol. One is to serve as a single entry point. So when a patient relapses, we want them to enroll on the screening protocol, and we will gather some clinical information about that patient, as well as do some specific testing of their leukemia cells to identify potential targets or other features about their leukemia that will help us then direct that patient and that patient's physician to an appropriate clinical trial, what we call therapeutic subtrials. There's another really important objective with this protocol, which is to maintain a longitudinal registry of clinical data about those patients and also collect their samples of their leukemia so that investigators who are doing really important research in the lab can have access to those samples and can learn at a more basic science level why children are relapsing, why their leukemia didn't respond to the therapy in the first place. So the protocol is really geared towards children, adolescents, young adults, patients who are less than 22 years of age when they have their relapse. And we collect, as I said, we collect clinical data, we collect a sample that's sent to a central flow cytometry lab called Hematologics in Seattle. And for patients with myeloid leukemias, which is where really the bulk of the unmet need is right now, we're also doing some targeted DNA and RNA sequencing for those patients. And all those results are returned to the treating physician along with information about what subtrials might be open. We don't tell the treating physician how to treat their patient. We just give them information and let them make the best decision for their patient, depending on, all of those other factors that the treating physician really knows best for their patients. So right now, this protocol is open at more than 160 sites, including the United States, but also some sites in Canada and some sites in Australia and New Zealand. We have more than 200 patients enrolled so far. We opened in April of 2022, so it's been a little over a year and a half. And our pace of enrollment has really grown. So we're enrolling, something like 16, 17 patients a month, which is really exciting, just to think about all the data that we're going to gather for those patients. More than 95% of families are agreeing to the optional biobanking. So in addition to collecting all this data and characterizing these leukemia samples, we're also able to store them and really help feed some of that important translational research that we think is so critical to moving the needle for these patients with leukemias, relapsed leukemias. We have a fairly short list, I would say, of relapsed leukemias that are eligible to enroll on this trial. So anybody with a relapsed myeloid leukemia, so whether it be AML or myeloid leukemia of Down syndrome, we're even enrolling patients who have therapy-related AML, which is, I think, an under-recognized problem and certainly an understudied problem in pediatrics. And then we're also enrolling patients with relapsed T-cell ALL. Again, that's really a big unmet need in the ALL world. Patients with relapsed mixed-phenotype acute leukemia, and then some patients with different subsets of relapsed B-cell acute lymphoblastic leukemia. We're targeting those patients with relapsed AML, collecting some extra data about them because we really want to know, for patients who don't enroll on one of those therapeutic subtrials, we want to know how their physicians are treating them. And so we're asking the sites to tell us, what chemotherapy did you give to those patients? How did they respond to it? Were they able to achieve a remission and get a stem cell transplant? We know that cure after relapse for AML is really not possible without a stem cell transplant. So how successful are treating physicians in getting their patients to that really important milestone? So we're learning that treating physicians out there are using a lot of gemtuzumab, ozogomycin, for example. They're using a lot of venetoclax, which is kind of the latest, greatest thing in the pediatric AML world, using it in a lot of different combinations. And so, this is such great information for us. And as this data collection builds, one of the things that we really hope to be able to use it for is to establish a data set that can serve as historical control data that will help us as we are designing clinical trials in the future, help us with some of those statistical considerations so that we can really be more informed about the design of our clinical trials, so that we can open more trials, get more patients enrolled, and really solve some of these unmet needs for our patients with relapsed leukemias.